from far places just to come and find that the machine is not working. When you go to the same institution, UTH, Mr. Chairperson, when you go to the same institution, UTH, more especially the fast track hospital, this is the more reason why people are going outside the country to access healthcare services, because we don't pay attention to important facilities such as UTH. The fast track hospital, which is supposed to save the halves, is more like Kanyama Clinic. Not even doctors are there. You go there, you spend 2 hours waiting for the next doctor nurses to go and pick a doctor from a premium hospital. There are no medicines. There is literally nothing. Even BP machines are not there. So this allocation to the ministry is very important, and we expect to see a lot of changes, more especially with this kind of an allocation. Mr. Chairperson, the other issue is the issue of understaffing. The staffing, the doctor-patient ratio, Mr. Chairperson, has not reduced. We need more doctors to save our people. We have facilities we have facilities that have no doctors. You go to facilities where there are doctors, you find one doctor saving a lot of patients. This should be addressed with this kind of an allocation, Mr. Chairperson. Mr. Chairperson, I need your protection. This girl keeps on making noise whilst I'm debating. Who does she think she is?
Order.
Mr. Chairperson.
Order, honorable member. There is a point of order that has been raised.
Thank you very much, Mr. Chairperson. I rise on point standing order 65, which says that the information we share on the floor of the House is factual. The member who is on the floor of this House, other than his uncouth language, is also peddling information which says that...
You didn't state the standing orders that
65.
have been reached. 65 what?
A. The member who is on the floor of this House, who has probably never been to a hospital facility in the past 1 year, knows that the drug availability in all our hospitals has improved to above 70% in all our clinics and hospitals. These are reports we receive every day. They are in the public domain. Is he therefore in order to mislead himself, to mislead the public, and to mislead you, Mr. Chairman, and to mislead his party, the Patriotic Front #2, that there are no medicines in our hospitals? I seek your very serious ruling in that regard. Thank you.
Order. Honorable member on the floor, let's ensure that as we debate, we should debate from an informed point of view. I think the honorable member who rose on a point of order is basing on the official government position that has always been stated by the Minister of Health on the floor of the House. So let's ensure that we don't just make assertions for political reasons. You can continue.
Mr. Chairperson, I thank you so much. Like I indicated even yesterday, it's difficult to debate in this House. When you are trying to present facts, for as long as one person who is just here for point of orders raises on a point of order, then you are completely out of order. Even when the fact is there that some facilities do not have medicines.
Now are you trying
even
are you challenging my guidance, honorable member? I've guided you, and then you are challenging my guidance. You may proceed.
Thank you so much, Mr. Chairperson. Mr. Chairperson, I was saying the fast track hospital at UTH also needs attention so that the halves can be going to that hospital instead of them going outside the country. The other issue, Mr. Chairperson, is the distance moved by our people in rural areas to go and access healthcare services. At least 50% of our people in rural areas are still moving more than 5 kilometers to find the next health facility. And even when funds are allocated under CDF to construct health facilities, equipping and operationalizing these facilities is taking forever. I know a number of places that have clinics been built, but they are not operational because the ministry has not moved in to equip those facilities. The other issue, Mr. Chairperson, is the issue of infrastructure. We have most areas that have unfinished infrastructure, more especially district hospitals. In Mchinga, we have about 2. I know even in Eastern, I know even in Southern. Those, they need attention so that our people can be accessing these health services from within the district. Mr. Chairperson, the other important issue to address is the issue of mortality rate. I know there has been a decline, but still there is much to be done to ensure that this is completely eradicated. We should not allow a situation where women are dying when giving birth. Mr. Chairperson, with those few words, you are ever in South Africa, you don't even know how our people are suffering, and you are here passing those running comments. Thank you so much, Mr. Chairperson.
Thank you, Honorable Member. Mr. Miyutu.
Thank you, Mr. Chairperson. Mr. Chairperson, I just want to add a word to the head, Minister of Health, which is one of the cardinal ministries of all the ministries. The background of the ministry, Mr. Chairperson, is that there was a crisis of labor. Health facilities had almost like non-available labor. The staffing levels in many of our institutions had 1 or 0 to 1 health workers. There came the UPND with its vision, and the vision which gave light to the people, including those in the far areas in Karabo. The recruitment of the 13,000 health workers, which gave a positive impact on the delivery of health services in the district of Karabo and other rural areas. That is a plus. There was also a big challenge of accessing medical drugs. Our hospitals and clinics had run out of these essential drugs. The ratings, I remember there was that report which was not well accepted, but it laid down the facts on the ground. The facts were that the stocking level in these clinics and other health facilities was below 50%. But now, Mr. Chairperson, today as we are speaking, like for Western Province, we receive updates every week on the stock levels of drugs in the facilities. And the rate shows beyond 75%. Now, from what the minister has read in the policy statement, it gives us hope that even the 2024, the drug levels in our health facilities will continue rising and improving. However, Mr. Chairman, when you visit these facilities, the workers face a number of challenges. I know there's the influence of CDF on the infrastructure and other services, but the challenges, for example, transport. You find these workers, they walk, they go to the district to collect these drugs. Sometimes they take reports to the district walking. Sometimes they have to hire ox carts, which is not a very good situation. There should be a move, a measure. If not vehicles, even motorbikes can help so that the morale of these workers also is improved and enhanced. Inquiring from these workers, schools, they get enhanced school grants, which help in delivering the education service. So we're expecting also a similar measure on the health facilities. But it's the opposite. Visiting the health facilities, inquiring from them, those grants which they get, first of all, they don't receive them monthly. Secondly, they are a meager amount. All the facilities in Karawo, other than the district hospital, they receive less than 1,000 kwacha. When you relate the cost of goods and services to how much health facilities receive, it's almost like a peanut or a drop. So there must be an effort to improve on the grants to enable those facilities manage to secure things like spirit and other logistics which they use in them to deliver the service to the people. Also, Mr. Chairman, there's a challenge of infrastructure. Many of our health facilities don't have enough and adequate staff accommodation. So there's need also to look into that as the ministry continues employing these health workers. There's also need to improve on the staffing accommodation for them. Mr. Chairperson, in my conclusion, there is hope that the ministry, from the policy statement for 2024, there will be enhanced service delivery and the people are going to cherish the works of the New Dawn government, which was voted in, and it will continue giving inspiration to the citizens. Thank you, Mr. Chairperson.
Mr. Banda.
Thank you, Mr. Chairperson, for giving the good people of Muchinga an opportunity to debate a very important head for the Ministry of Health. In the first place, the people of Muchinga would want to commend the New Dawn government for the continuous recruitment of health workers. This has given a chance to the rural population to have the health workers attending to their health at all times. I must also mention that it is a plus for us who represent rural constituencies that we are doing a lot of health facilities in terms of constructing
clinics. Mr. Chairperson, in the near future, maybe within the next 2 months, in Muchinga we'll be launching 7 health facilities. And with the recruitment of 3,000 or plus health workers, we are assured that our health workers, our health facilities will have people working in there. However, Mr. Chairperson, allow me to state that we have a challenge at our district hospital of utility vehicles. Mr. Chairperson, Serenje is running only on one utility vehicle, which is being shared between the hospital and the district health office. This is not healthy for our district, which is big. I must also mention that in Serenje, the population has grown. The coming of the mining companies, the smelting of manganese, has brought a lot of people in Serenje. And Serenje is allocated along the Great North Road. We need a trauma center so that Serenje can start dealing with, there are a lot of accidents along Great North Road and other mining-related accidents. We need this facility like tomorrow, Mr. Chairperson. Mr. Chairperson, as we appreciate the good work that is being done by the New Dawn government in providing healthy close to the people, bringing health close to the people, we must also mention here that we have got populations that lives very far from Serenje district. Like the people of Kavansa, they have to travel 150 kilometers to reach Serenje Boma. Mr. Chairperson, as if that is not enough, these people will be referred to Kawe General Hospital. And these are very, very underprivileged people, not to use the other word. That even traveling 150 kilometers, it is on foot, maybe for 3-4 days. For this reason, Mr. Chairperson, as people of Muchinga and Serenje, we are calling upon government to consider upgrading Serenje District Hospital to a general hospital. It's high time that government now should look into these district hospitals and upgrade them. We have got hope in the New Dawn government. That's the reason why we are saying this. Since 1964, our rural people have been suffering, being referred to Lusaka. And transport from the remotest area of Serenje is very expensive just to reach Serenje Boma. Now consider again paying another 300, 400 to Lusaka just to come and access medical services at UTH, Levy, and so forth. It's high time that the government, the New Dawn government, a very capable government, a government that has shown that it is putting the interest of the people, especially those in rural areas, first. Because by giving us 28-point-something million of CDF, it means the government is considering people of the rural. It's the first time that people in rural areas now can boast of having health facilities 5 kilometers from where they stay. In the past, they would travel 20 kilometers within the rural localities to find a health facility. So this is the reason why I firmly stand here, Mr. Chairperson, asking that the New Dawn government, please, should consider upgrading Serenje to a general hospital. While we are also planning using CDF as Muchinga to construct 2 mini hospitals, one in Chivale and the other side to be located in Kanona or wherever. This is going to make it easier for our people who travel a long way from Kavansa, Chisomo, Nakalengule, Mukopa, to mention a few places, to access health facilities before they are referred to Serenje, which if government is going to act as we know it, will be a general hospital. And then, if things need, of course, we will not complain if one is referred to UTH. We have a lot of hospitals within town. I quote yesterday, the minister said almost every constituency in Lusaka, almost every, except maybe one, has got a district hospital. This is a place where you just pay 5 kwacha, you are at the next big hospital. Unlike where I come from, someone has to pay
150 kwacha from Chewale to access a hospital in Serenje. Someone has to pay 200 kwacha from Masase to come and access healthy services in Serenje. Now, think of it on top of that, again being asked to pay 400 to come to Lusaka. Mr. Chairperson, I'm really happy over what is already happening, the provision of health facilities. On this one, I would emphasize that as a representative of the rural people, we have really benefited. We have really benefited. And I want to also thank the Honorable Minister of Health, who, in our own view, is a very capable minister. You know, we have got what we never had. Even if I'm saying this, it's because of the hope that this government has given us, that they can do. Hence, I'm standing here saying, Serenje now should be a general hospital. And I would also want to, through you, Mr. Chairperson, ask the Minister of Health to visit Serenje one of the days and meet with our investors who are also doing a lot. They have constructed health facilities within their localities, such as Safo at Kanona, and we have got Pieroala at Mkando. With this, if we can try to partner with them, we can have some of the medical equipment that we don't have even at our district hospital. Mr. Chairperson, with these few remarks, I want to mention here that I support the 18.7 billion kwacha budget, but I would also ask government to increase it by doubling it or even triple it so that the government can construct us a general hospital. Mr. Chairperson, I thank you.
Thank you. And I should commend you, Honorable Member, because it's good to appreciate someone, especially these ministers, while they are still in office. It's good like that. Our culture, you know, as Africans, we like appreciating people when they are dead. But let's appreciate when they are doing well, so that they even do more. Thank you. Mr. Mwida.
Mr. Chairperson, I thank you for this opportunity to also add the voice of the people of Mufrira to this budget on health. Indeed, this is a very important head, Mr. Chairperson, because it affects all of us in this country. And how I wish on a day like this that we are debating this very important head, every elected member of parliament was sitting in this house so that they can speak for their people. It is sad that when we are debating this very important head, we have 19 of our colleagues at home. The people of Shuangandu needed to be here so that they can speak for themselves. The people of Kampinsa needed to be here.
You are out of order. Content of your speech. How do you bring people that are facing disciplinary action? People that they were found wanting by this house. This house resolved. It was not an issue that one person passed a decision. It was a resolution of this house. So your statement is contemptuous. Because this was the resolution of the house. So let's ensure that our content of speech is up to date. You know the guidelines. You may continue.
Mr. Speaker, I'm well guided. I was just doing my opening remarks. Mr. Speaker, I must say that as the people of Mufrira, we hesitantly support this budget. And I will give you the reason why we are doing this. Mr. Chairperson, this year, 2023, the budget that was approved included funds meant to complete 36 district hospitals across the country. This is a commitment that was made even in the presidential speech when he came to open the second session of Parliament. Even the budget speech also contained the same information. And the budget for this year, Mr. Speaker, we sat here like we are doing today, approving the budget of the Ministry of Health. And there was a commitment that said 6 district hospitals are going to be completed. Mufrira has got one such facility. Before then, when I stood there asking when the government is going to complete the hospital, I was told at 60%, but when funds are available, the facility was going to be completed. Now, this parliament, Mr. Speaker, made the funds available this year to complete that district hospital in Mufrira. Among the 36, we are now remaining with 1 month. Up to now, the site has no contractor. There is even no information what is happening. Where has the money that was allocated to complete that district hospital gone? I don't know if it is only the district hospital in Mufrira, if these other 35 have been done and completed, but if that's the case, what have the people of Mufrira done to this government? That today, with 1 month to go, the funds that were allocated to complete that hospital have not been released. There is no contractor. The site is vacated. In fact, it is suffering vandalism in its state. At the time the contractor was leaving, it was at 60%. But today, I can tell you that it's far less than 60% because it has been vandalized. There's even no security there to protect it. Mr. Chairperson, the people of Mufrira are asking, when is that district hospital going to be completed? Because the funds were approved in this year's budget. 1 month to go, nothing is happening. That is why I said, hesitantly, we are supporting this budget, but we would like to see more in terms of infrastructure. And talking about infrastructure, Mr. Chairperson, I know there has been a lot of talk that we use CDF. But the reality also is that these construction projects that are happening under CDF, most of them leave much to be desired in terms of the quality of work. When we talk about completing the maternity wings, when we talk about building even clinics, being handled locally at the local authority level, the quality of the contractors and their workmanship leaves much to be desired. We should not be wasting money, Mr. Chairperson. Some of these big assignments, some of these big projects, better the money remains at the central government, and the central government, through the normal channels, take charge. In this way, we will be constructing a clinic, we will be constructing a maternity wing that will last long. Because in some cases we have seen that immediately the CDF project is completed, now we are in the rain season, roofs start getting blown up because the local contractor with little capacity, little experience, but lots of money. My appeal to the Minister of Health, through you, Mr. Chairperson, any infrastructure money under Ministry of Health should not come through CDF. Let the ministry hold that and use their experienced expertise and staff within the ministry and other line ministries to supervise, to contract and supervise these works. Otherwise, we will be launching these projects under CDF, and soon after that, they start breaking down because the workmanship is not okay. Mr. Chairperson, I will not spend all the time. Having said this, hesitantly, we support this budget. I thank you.
Mr. Nyambose.
Thank you very much, Mr. Chairperson, for giving the special people of Chasefu to add their weight on this special budget for the Ministry of Health. From the outset, I want to support wholeheartedly the budget for the Ministry of Health. Actually, if I had a way, I would have asked for an increment, but due to the pace is limited, I would support this budget. My debate this afternoon will center on the most important thing, which is human resource. I want to thank you, Honorable Minister, and the government for recruiting of workers in the ministry. And I want to thank you once again for procuring drugs. We have inherited a situation where there were no drugs. But now we are talking about a minister who has come here to tell the nation, and indeed we are seeing drugs are reaching our areas. But now what happens in the administration of these drugs, especially to us from the rural constituencies? Honorable Minister, how I wished we had a way of auditing the administration of these drugs in the clinics. You check how many people access these drugs. When you give these drugs to the hospitals, how many people access them? Within a few days, drugs are not there. They are told we have no drugs. You go to the next private pharmacy or private shop, you find these drugs are plenty. Where do they procure when government is struggling to get these drugs? There must be a way, Honorable Minister. And I want to encourage you, Honorable Minister. I've seen you, I've worked with you. Where you visit these health centers, I don't know why you stopped. The other thing I want to talk about, Honorable Minister, is the issue of doctors. I don't prescribe to a situation you have a doctor who is a manager at a health center. Why do I say so? One of the principles of Henry Fayol, management a specialist, one of the 14 principles is the separation of work, division of labor. Why should a doctor who is trained to treat patients find himself to be a human resource manager? One of the principles again is order. One of them is order. Order means a place for everything and everything in its place. If you are a security guard, you cannot be a plumber. If you are trained as a doctor, you must be in the ward. Human resource personnel take human resource as a field to manage personnel, regardless being a lawyer, regardless you being a doctor. You must be managed by a specialist in human resource management. Our trained people, if they want to be remunerated very well, let them get a better pay, but let them be in the wards. If there was a policy, I would encourage people to ensure that they go back to the wards so that they are able to give expert treatment to our patients. Why is it that the same doctors, when you find them in the public institution hospital, the quality of service is different when you meet them in a private hospital? This is our country, countrymen. If you're a doctor, you choose to be in the ward. Let the human resource personnel. There's no way a doctor should be administering a human resource officer. You are a doctor. If you're a plumber, you know how to fix water pipes. You cannot be a plumber, you want to be in the court. So something is wrong. So for us to help this ministry, let the doctors be remunerated very well. But let them be in the wards. Let human resource treat so that we can have quality health care for our country. And one of the principles, I need protection. I need protection from doctor here. I need my cousin here. So what I'm talking about, Chairperson, what I'm talking about is that when people are specialized, one, productivity increases. People are able to do that which they are trained for with the speed and the efficiency, and the end result is effective health delivery. We must agree to this fact. So as long as we help, our minister was going round one day. She was asking, how many doctors you are here? I felt encouraged. But I don't know why she stopped. Honorable Minister, continue. People must be accounting for their time in the wards, in the offices. Here I'm told the 14:30 I should be seated. 18:40 I should leave. Why should I be somewhere else instead of being in Parliament? So this is a fact that I'm trying to drive across. That the moment we do that, this country healthcare system will improve. The quality of monitoring of drugs in Chasefu. How do we monitor these drugs? They find themselves in Malawi. We must find a way of tracking. If we submit, we give them drugs. They are the same people who turn around in this hospital, there are no drugs. And yet this minister and the government and the president has ensured that drugs are available. We must hold these people accountable. Coming to the rural constituencies like my constituents, I would love the ministry to have a policy where if an in charge of a health center works for 2 years, it must be moved around. So that familiarity should be avoided, because they say familiarity breeds contempt. So that people are able to serve our people very well, efficiently, for the purpose of efficient health delivery. This is done. We must say today, if we have a policy change, this will help. It is not demeaning our health personnel or doctors. They should go back for where they were trained. And I want to appeal to many of you to say, Nyambose, what you're saying is correct, and we should go back to the policy to ensure that each one should be where he belongs and where he is trained. I submit and support this budget.
Mr. Msanje.
Thank you so much, Mr. Speaker, Chairperson, for this afternoon, for giving the good people of Mbabara an opportunity to support Head 46, Ministry of Health. Mr. Chairperson, I wish first of all to register our support and commendation to the new Dawn government, the UPND new Dawn government, and the Honorable Minister of Finance and Health for the excellent delivery of quality health care services in Zambia. The health budget has increased by 16.5% and representing 11.8% of the national budget. This is as it should be towards attaining the Abuja Protocol, where every country is supposed to reach around 15% spent. This is the first time in the history of Zambia that we have moved very close to attaining the Abuja Protocol. So we need to commend and actually say here to the UPND New Dawn government for ensuring that we are reaching this milestone. Mr. Chairperson, I want to point out to a few important areas for us in Mbabara. One of them is the recruitment of health workers. We wish to commend the New Dawn government for the almost 12,000 plus health workers that were recruited last year, another 3,000 plus being recruited this year, and another 4,000 plus for next year. This is an excellent development, because in the past, Mr. Chairperson, this was never heard. Recruitment was done in secrecy, and for the first time now, every citizen is getting a job, thanks to the New Dawn UPND government and His Excellency President Hakainde Hichilema, who is ensuring that we have a transparent and accountable government. Mr. Chairperson, in Mbabara, we've got health centers such as Kachenje in Nchembe Ward, Mwanancheu in Mangunza Ward, Hagaroba in Simaobi Ward, Kaseko in Macha Ward, Harumba in Ngonga Ward, Maubwe in Mbabara Ward, Mayobo in Mayobo Kabanze Ward, Nabukowa in Nchembe Ward, and Narube and the Kabanze maternity wings newly built under CDF, and many others, Mr. Chairperson, that need to be operationalized, including Namianda Clinic. These clinics have been completed with the support of CDF. So we have done our part, Mr. Chairperson, and we're now requesting for the Ministry of Health, through these recruitments, to send us the necessary personnel so that we can equip and operate these clinics and begin to serve the people of Zambia in a more equitable manner. Because these health centers, in line with the vision in the National Health Strategic Plan, will be taking health as close to the family as possible. They will be They are spread all over the constituency, including these two maternity wings that are in line with the presidential directive to ensure that we build maternity wings. So we humbly request our hardworking Minister of Health to ensure that these centers are immediately operationalized within this year before we close the year, Madam Honorable Minister of Health, because you are recruiting the staff. And I know you are an actions person who is going to ensure that the people of Mbabara benefit from the good work of the new Dawn government by having these clinics operationalized. And also, from the building of the new clinics, we have submitted our list of requests to the Minister of Health. Please do consider us for that, to ensure that we have also a government-built clinic in our constituency. We don't have one right now. Most of these we have done them under CDF. So we will ask that the government also comes on board to meet us. Mr. Speaker, I also want to talk the issues of non-communicable diseases that the Minister of Health will need to continue to pay attention, issues of eye health, where we need the personnel to be in the staff structure of the Ministry of Health. We need more personnel in the area of ophthalmology and optometry and related services in eye health, which will continue to improve the quality of life. As you can see, most of us are putting on eyeglasses. This is one of the refractive errors which we have, and we need these professionals for us to continue to function very well. Issues of ear, nose, and throat, especially among its children. Zambia's population has got 4.4% disability of children. So we request the Ministry of Health to pay attention to also ENT issues, which affect most of our children, hydrocephalus heads, as well as cleft foot, which we see a lot amongst our population. These are reversible conditions, Honorable Minister, which the Ministry of Health must not leave out, but must continue to soldier to help these children so that they can also live a normal and functional life. The issues of ensuring that NEMA does provide calipers and other assistive devices to persons with disabilities must be pushed to the highest level so that whatever is missing in terms of orthotics and the optics and other things that persons with disabilities need is provided for to ensure that we leave no one behind and everybody is supported. I also want to continue on the line. I heard about tuberculosis, notifications and issues there. Here at Parliament, again, we want to support you with the revival of the caucus on tuberculosis control, which was being operated by Honorable Karila and colleagues, and we now want to revive it because we are pushing for domestic financing. Domestic financing is the way forward in terms of ensuring that health services are spread and reach everybody in the country. So, Madam Honorable Minister, please do continue to work with us on these and many other issues. I want to continue to commend you also for the sexual reproductive health and rights services and products. We just had a business case meeting with the support of UNFPA, which you humbly opened very well this past weekend. And in line with that, we've got issues there to ensure that we meet the needs of our youthful population. Our population is very youthful, and it needs these services for us to ensure that we reverse the high teenage pregnancies amongst our young people, 29%. We reverse the increasing HIV/AIDS indicators amongst our young people, which are increasing. We need to reverse those and ultimately have healthy and quality citizens that are not susceptible to disease and that are able to work and contribute to Mother Zambia. Madam Minister of Health, keep it up. We commend you and we love you and we want you to continue to succeed. With these words, I want to thank you. I rest my case, Madam Speaker.
Oh. Thank you, thank you. I think the debaters, most of them, they're quite repetitive. We are, as an institution, we are piloting sector budget scrutiny, and we picked on 5 committees to start with. So what I expected, those that are in that committee, I expected a detailed approach to the debate. But I don't know, maybe the members in that committee haven't yet debated. Those that are in that committee, we expected detailed, so that we are able to roll it fully next year, that all the committees. But if we're not seeing anything different, then it's disappointing, because we are piloting. So members in there, we expected a detailed approach to the debate, because you had more time to scrutinize the head. However, let's proceed. Dr. Chirufya.
Mr. Chairperson, I want to thank you profusely for this opportunity to contribute to the debate on this critical head 46 on health. Chairperson, let me begin by sympathizing with the Minister of Health. The restrictive rules of the House could not allow her to present a coherent and comprehensive policy statement. And I urge that the House reconsiders that, so that ministers can present comprehensive policy statements, so that we can have informed debates on the matter.
Honorable Minister, what are you trying to say? The Minister states the government position. So this is what government presents. So let's ensure that we debate with what government has presented, not what you think as a member that government should present. The two are different. So let's present to what has been, let's debate to what has been presented. You may continue, Honorable Member.
Chairperson, I think I've been misunderstood. Chairperson, what I meant to say was that for patients, for members of parliament to present, to debate informed, the minister should be allowed to present wholesomely. And if the minister rushes through a policy statement, it means that we're incapacitated to respond adequately. And I'm just making a polite request to the chair that this be reconsidered, so that we can hear the whole policy statement, so that as we respond, we're able to respond to the policy statement that the minister has said. Chairperson, I'm guided. Chairperson, a functional health system focuses on universal health coverage, health for everyone, everywhere. And I've heard the policy statement by the minister, and I want to state, Chairperson, that the ministry is focused on ensuring that we provide adequate health services, high comprehensive health services for everyone, everywhere. Chairperson, this summons us to the inescapable imperative to strengthen health systems to align to the global agenda for universal health coverage. Now, Chairperson, I want to state quickly here that the epidemiological profile for the country is fundamental to budgetary allocation of resources. If we look at the strategic plan 2022-2026, the Ministry of Health has told us that the highest case fatality rate is attributable to cardiovascular diseases. Chairperson, it means that there should be money placed in this intervention, and broadly speaking, in non-communicable diseases, to ensure that we respond to our epidemiological profile. I see a very big disconnect in resource allocation. I see that while the Minister of Health is telling us that the case fatality from non-communicable diseases is very high, I do not see adequate resource allocation in the budget to interventions that will prevent these non-communicable diseases. Chairperson, if we look at the number of people dying out of hypertension, that is strokes, diabetes mellitus, and even in lower age groups, rheumatic heart diseases, Chairperson, you realize that the numbers are alarming. And that is in the statistics from the HMIS. I would request that the minister considers, one, reversing the decision to restrict the health promotion department, and ensure that the health promotion department is not only expanded, but also given adequate resources to empower people with adequate knowledge on how to prevent communicable diseases. Non-communicable diseases. Mr. Speaker, going forward, universal health coverage focuses on a strong health system. Infrastructure to expand access to health services is critical. And what I see, Mr. Speaker, is that the budget has appropriated, or there's a proposal to appropriate adequate resources to infrastructure expansion. That is commendable. It is commendable. However, the reduction compared to the previous years needs to be put in check. We need to continue to appropriate adequate resources to infrastructure expansion to push towards universal health coverage. Mr. Speaker, supply chain. I note that the minister has increased the amount of money allocated towards drug procurement. This is commendable, and let's deal with a legacy date for drugs, and let's ensure that procurement processes are within the law, and procurement processes are such that we do not bring on board suppliers who will not bring highly efficacious medicines. Mr. Speaker, we must support access to efficacious medicines for everyone in this country, and we must ensure that the money that is increased in drug allocation translates into access to safe and efficacious drugs for everyone. Mr. Speaker, on healthcare financing, I still bemoan the fact that NEMA still sits at Labour. I call upon the executive to quickly revert NEMA to the Ministry of Health so that we can address the issue of healthcare financing. It's silent from the minister's policy statement. Mr. Speaker, on health security, I also noticed that we have not appropriated enough resources towards protecting Zambians from public health emergencies such as COVID and cholera, and indeed any other emerging conditions, including neglected tropical diseases such as anthrax. Mr. Speaker, this must be addressed. Health information management systems, Mr. Speaker, we need to address this very urgently. Information must give us direction on where the money must be placed. Let's place resources where impact shall be highest. Mr. Speaker, on leadership and governance, I would expect that the Minister of Health would create a critical mass of leadership in the sector, from the national level to the implementation level at district level, to ensure that the universal health coverage agenda that is at global level is addressed. Mr. Speaker, as I conclude, I want to state this. Any functional health system focuses on providing health services for everyone, everywhere. It requires adequate health financing. I'm not seeing it. While there is movement towards the Abuja Declaration, I believe there's room for us to adequately finance health promotion, disease prevention, curative health services, rehabilitation and palliative health services. I say so, Mr. Speaker, looking at what's obtaining in our hospitals today. Laboratory services are relegated or delegated to private facilities, even just at UTH here. You can't do adequate laboratory services, you have to go to the private sector. Mr. Speaker, this must be addressed urgently. And if we have to unite as a nation towards a common agenda for sustainable economic development, we need to address the issue of a productive, healthy workforce. That requires us to invest adequately in the health system. I call upon the minister to address the issue of a strong health system and address all the parameters of the health system and ensure that it's adequately resourced. And let's speak to the parameters in our epidemiological profile so that impact is optimized. Mr. Speaker, I thank you.
Thank you. Ms. Katuta.
Thank you so much, Mr. Chair. The Ministry of Health is the most important ministry in our country, even in other parts of the world, because a sick nation is a nation which cannot develop at all. So Mr. Chair, um, I must say I support the 18 billion, but I've always thought such ministries, Ministry of Health, Ministry of Home Affairs, they deserve more because this affects every Zambian regardless of your political affiliation. Mr. Chair, I want to talk about this budget. Though I wasn't in here, I just came when the minister was almost winding up. Each time I listen to all the ministers since I became a member of parliament from 2016, they seem to concentrate on communicable diseases. I don't hear much about mental health. We've neglected the mental health in this country. And if you go to Chinama right now, it's a sad sight. Look at the rooms where we keep our patients. They are patients just like any other patient. Anyone with mental health problems, Mr. Chair, the truth of the matter is that every human being, according to the scientists, that we all have a level of madness. It's on that maybe that goes beyond. So, Mr. Chair, this is serious, and I wonder why somebody would even question. The reason why they are questioning, because that madness now has started. It's about to increase, but we will calm it, we'll pacify it. Mr. Chair, we've neglected this department. We really need to take care of these patients, Mr. Chair. And if you look at the medicines of the mental patients, there are no medicines for the mental patients. And these medicines are very, very expensive. Not even in NEMA sometimes can cover these medicines. It's the reason we are having all these issues. You hear somebody killing a wife or what. Those are mental issues. And those are the things that we as lawmakers, we should look at seriously. What kind of hospitals do we have? And how do we end the stigma using the Ministry of Health?
Point of order.
Mr. Chair.
There's a point of order.
It's a point of disturbance.
Mr. Chairman, I want to thank you for the opportunity to raise this very important point of order on the member who is speaking, the Honorable Member of Parliament for Chienge, Honorable Bishop Given Katuta, who continues to call you Mr. Chair. When I know from the time I was small that the chair is a piece of wood to begin with, and the chairman is a person who's sitting in a place such as where you are. Mr. Chairman, furthermore, she has now made a lofty statement, and I'm referring now my point of order for both my first part of calling you a piece of wood and stating that everyone in here possesses a certain level of madness. Mr. Chairman, would she be in order not to exclude everyone and just include herself if she feels that she has a certain level of mental derangement? I seek your serious ruling, Mr. Chairman, and I'm beginning to think that she may be right on her part, especially when she continues to call you a piece of wood. I seek your ruling.
Order. Honorable Member for Chiengi, Mrs. Katuta, I think you should mind the content of your speech, calling everyone here that they are not okay. It's not all right. I know maybe on a lighter note, maybe you may understand yourself better, but that is not good. May the honorable member continue.
Thank you. Every human being has a level of madness, Mr. Chair. And Mr. Chair,
Honorable member, you've been guided that you should not
yes,
speak.
well
Don't-
guided, Mr.
Yes,
Chair.
I'm the chairperson, I'm not the chair. You may continue.
Thank you, Chair. Even the point. Mr. Chairman, I can't pronounce that. Back to business. You know, some points of disturbance, Mr. Chairman, I think is also leading to what I was just talking about, mental something. Mr. Chairman, we've neglected these patients as a nation for quite some time. Mr. Chairman, I would prefer to see that the ministry comes back here in the next budget for 2025, showing the nation and this House that we are going to have a new hospital. If you go to Ndola Central Hospital, the mental side of the hospital is a site. In Mansa, it's the same thing. Here at Chainama, it's the same thing. Most people make funny over these patients. It's just those who are in this field will agree with me. It's just a disease. So I think it's very important that when the budget is being prepared, we consider such non-communicable diseases, so that in the future we hear of hospitals like the heart hospital, which we have for the heart patients. This is what we're looking at. We have a hospital for the cancer patients, and it's a beautiful infrastructure. Why don't we do the same for the mental patients? They're human beings, they are our relatives. And above all, Mr. Chairman, the truth of the matter is that we don't have medicine in the hospitals. I must say this, my mother was in hospital 2 weeks ago. All the medicines at UTH Premier, we were buying across the road. So when I hear people making fun and trying to politicize things here, it makes me very sad. We need to give and help this government to say there are no medicines in the hospital. It's a fact. And if we want to continue to try and to take things lightly, then we are not helping the people of Zambia. Go to any clinic. Wherever you go, you find a prescription just to be written. I ended up going to Coptic to go and get the medicine from there. So the truth of the matter is that let's take this seriously. Let's find out where the medicines are. And we would want to hear that so much has come into the hospitals, and so much this is the stock level of the medicines. But the truth of the matter is that let's not try to, what we say in my language, ukumyangana mumatwi. No. What is wrong is wrong. What is not there is not there. Meaning we cannot just entertain our ears. Let's just be candid and factual of what is prevailing on the ground. Let me speak now on behalf of Chiengi, Mr. Chairman. Chiengi, we have a district hospital. And if you go there, we are understaffed to an extent whereby you'll find that there was a doctor maybe at a certain small these main hospitals being transferred to the general hospital, leaving people without doctors. And if you look at, we have two places which are highly populated, Mununga area and the chiefdom of Chief Puta. But when somebody passes on, you need to carry that body to Chiengi Mortuary Hospital, which is wrong. We need to have mortuaries. We need to have mortuaries. Like in Mununga, we need to have not even a mean hospital, some hospital where we can have even a mortuary. We cannot be carrying people, using motorbikes to wind up. Mr. Chairman, I believe every member here will agree with me. We need mandamandas the vehicles which carry corpse. We need that. We cannot wait for CDF money. People are suffering and they need that, and we need more ambulances. We cannot be allocated with one ambulance. I thank you, Mr. Chairman, but mental patients should be taken care of.
Thank you. Mr. Mapani.
Thank you so very much, Mr. Chairperson, for allowing me to add 2 or 3 sentences to this very important motion which is on the floor of this House today. To start with, allow me to support the budget and that the increment that has been given to the ministry, we expect a lot of things to happen. Mr. Chairperson, we have seen that an increment is of 2.7 or 2.6 billion kwacha, and going by these factors, these values, we are pretty sure that a lot of things will happen under this ministry. Further, Mr. Chairperson, because of the amounts, and going by the statement that was raised or submitted by the minister yesterday, it's our hope that a lot of CDF clinics and health posts which were constructed last year and this year, I think will be commissioned, and not only being commissioned, we expect equipment as well to be given to these hospitals so that all the standards that are required for one building to be called a health post will be met. Further, Mr. Chairperson, it's very important that the issues of workers, transfers of workers will be instituted during this period. Why are we demanding that? We have observed that there are health workers who have been in these institutions for more than 20, 25 years. And it's our normal belief that when somebody has overstayed, they tend to develop what we call a laissez-faire kind of attitude towards work. But with these funds and a good amount allocated on transfers, we expect actually the ministry to ensure that this act is performed so that in these health posts we are able to have new blood, new thinking, so that we are able to deliver on behalf of the people. Mr. Chairperson, it's also important to indicate that the issues of recruitment, we actually appreciate the government position on recruitment. We were able to recruit 11,000, 3,000, and now we're expecting another number, which will make sure that within these health posts that we have constructed under health money, sorry, CDF money, we are going to have not only numbers, but professionals as well, so that at the end of the day, the people of this country will be able to actually receive the services that we have always longed to have. There are hospitals that we expect to be completed. These are some of the district hospitals that were left by the previous regimes. These are the people who started this project, but unfortunately, they were not completed, but they were open to the public. And this is the advice that we should not go with. It's very important when a project is started, Mr. Chairperson, sir, that all the requirements are supposed to be met, installed in these hospitals before they can be opened to the public. We understand the desperation that people were in before, and this was purely done on political mileage, which definitely never added value to the citizens of this country. So it's my appeal to the minister that as we proceed to 2024 and as we run through or spend this budget, we expected actually the ministry to ensure that such hospitals that were not completed by the previous regimes are attended to. Further, it's very important that hospital, district hospitals like the Namala one, which actually don't have a mortuary, equipment that people can talk about, we can also be attended to or be provided with such machines so that the people in Amala as well can receive the services that everyone else who are called district hospitals are receiving. Madam Chairperson, Mr. Chairperson, it's my hope that the budget will actually address these issues that I've highlighted: recruitment, ensuring that these CDF projects are opened, are not only opened, we're able to put new equipment, and not only new equipment, be able actually to ensure that the services that falls under what is called primary health posts or clinics are actually provided. It's also our hope that the new clinics, the hospitals that were not completed in the previous regime are actually attended to. Finally, we want to thank the Minister of Health for the service that we have actually started receiving as a country. Because in the previous regimes, like I said, not regimes, but of course regime, that a lot of drugs, as stated by the earlier speakers, went missing, some of course with an intention to deprive the citizens. We want to ensure that this kind of attitude towards government property or government medicines actually should be brought to a halt. The people of Zambia, particularly in the rural setup, actually are looking forward to ensure that what we demanded or what we claimed, what we promised the people pertaining the health services actually is achieved in these rural setups. With these few words, I submit.
Thank you. I know this head has attracted a lot of people. So Honorable Mr. Daka will debate, and then the Minister will wind up the debate.
Thank you very much, Mr. Chairman, for giving people of Chadiz an opportunity to add a voice to this very important head. Mr. Chairman, 59 years after independence as a country, we are still evacuating patients to hospitals abroad. Mr. Chairman, not necessarily that we don't have the medical expertise to attend to some of the ailments which we evacuate patients for to these foreign countries, but it's the environment, Mr. Chairman, which is not ideal. Mr. Chairman, learning from what the Indian government has done, I would want to, first of all, appreciate government for the fact that when we went to India, we found one of our professors attached to hospitals in India so that he learns some of the good practices that the Indian government has done in the medical sector. Mr. Chairman, what has the Indian government done to reach where they are now? First of all, they noticed that their hospitals were lacking key high-tech medical equipment. And what did they do? They invested heavily in acquiring these high-tech medical facilities and put them in their hospitals. Secondly, what did the Indian government do? They made sure that they trained their medical personnel in countries like the United Kingdom and other countries which has got a traceable medical background. Mr. Chairman, now eventually what the Indian government did was to recruit or attract their high caliber medical personnel to come back or to go back to India and work in these hospitals that they had heavily equipped. And one would ask a question, how did now the poor, how did they take care of the poorest of the poor? Mr. Chairman, the Indian government made sure that they introduced a medical insurance package which didn't discriminate any person. So, which means that even the poor of the poorest, Mr. Chairman, would still access these medical facilities, which the government handed over to be operationalized by private medical doctors. Mr. Chairman, when that was done, this is what has happened, that most of the countries, even patients from the USA, are able, the USA government is able to evacuate patients to go and seek medical facilities from India. Because the medical facilities in India are cheaper than in their own country, in the USA. Mr. Chairman, I only hope the government is going to learn these good medical practices that our professors learned from India, and would want to see, as people of Jadiza, that these recommendations should be put to practice. Let's see a change in our medical facilities with regard to improving on the environment where our doctors work from. Mr. Chairman, now I would want to narrow down to my own constituency. Mr. Chairman, my own constituency is suffering from an inadequate maternal facility. What is it that we are seeing at our district hospital? Our district hospital, especially the maternity wing, is heavily congested. Seeing women sleeping on the floor, Mr. Chairperson. And therefore, I would like to urge the Minister of Health to look into the plight of our women in Chadiza. Our maternity ward has got a very minimal capacity to handle the numbers that we are experiencing in the constituency. Mr. Chairperson, as I conclude, Mr. Chairperson, I would like also to talk about the availability of medicines. Most of our villagers cannot manage to buy medicine because most of the time when they go to these medical facilities, they are given prescriptions. And just imagine in Chadiza, a villager being given a prescription to go and buy medicine worth 100 kwacha. It's almost impossible. So let's make sure that, as I conclude, the medicines are readily available in our hospitals. Mr. Chairperson, I support this head.
Thank you. The Honorable Minister of Health, wind up debate.
Thank you very much, Mr. Chairperson, and thank you, members of Parliament who have contributed. I take note that we had a long list, and because of time, obviously, few have been able to debate. But listening to the various debates, there are a few issues that caught my attention, and I'll just try to, without specifically going to a particular MP, I'll just discuss these issues. I think one of the issues that has come out is the issue to do with drugs. And I want to thank those who have commended government for improving the drug levels in our health facilities. Yes, Mr. Speaker, I will say that regarding health facilities at the lower level, I don't think there should be anybody complaining. So anybody who complains about drug availability at a lower facility level is just politicking. But when it comes to big hospitals like UTH, Levy, and even some of the general hospital, I want to put it on record that we still have to stabilize. As you recall, I did indicate that the drugs, the bulk drugs from Egypt had been purchased. But as you know, the processes of validation and testing those drugs is still underway. And until that process is complete, we'll still have some of these complaints still coming. But I want to assure you that the fact still remains that government has procured essential drugs and even kits enough to last us for a long time so that these complaints are not there. Now, the issue of equipment is also a matter that concerns government. It is true also to state that a number of our health facilities countrywide do not have adequate medical equipment. But talking about cancer hospital and talking about CT scans and MRI, I want to say that it's important that when members debate these issues, we must try to be factual. Because when you are factual, you help the government. But when you just make statements because you read a story by some crazy guys that have nothing to do but just write articles in WhatsApp groups, and you bring that here, you will find that you are not helping.
Honorable Minister, crazy is unparliamentary. Replace it with another word.
Pardon?
Crazy
Oh, sorry.
is unparliamentary.
Crazy guys, okay. I don't even know what word to use. Sorry, but you know, some people just like writing. So I want to state, Mr. Chairman, that whilst admitting that we have obsolete equipment throughout the country now, this government has taken steps, and in taking steps, you can tell from the budget that there's a lot of money now that is being allocated specifically for those issues like equipment. And you see that this year, we have already, ZAMSA has started distributing some of the equipment that has been procured during the 2023 budget. So CDH 2, in terms of CT scans currently, they are working. UTH 2, one working. There is a newly acquired one which is still under repair. The MSMH is working, Chinsali is working, Ndola was repaired, Kitwe not working, Kasama not working, Livingston not working, Kawe newly bought, waiting installation. So that is the status of. Now, I know also that there are times when patients go to our facilities, somebody will tell them that this particular drug is not there, or they'll tell them that this equipment is not there. We have since found out that there are people who are doing that in a very dishonest manner, because either they want to make money from unsuspecting patients, or they just want to give government a bad name because they're politicking, which is really, really unfortunate. We have some cases where we've caught some people, and very soon when you start getting people getting fired, don't come here and start defending criminals or people who are doing things that are a danger to society. The other issue that also caught my attention was the issue of infrastructure. Whilst appreciating that government has constructed and continues to construct many facilities, including under CDF, the question of operationalization has come out. And you recall that from my statement, I did indicate that there are over 200 new facilities that have been constructed. We have costed the number of health workers that are required, over 7,000. But the fact still remains, these are issues of budgeting, finances, Treasury Authority. The truth of the matter and the fact of the matter is that this administration is committed, and you have taken note that they have continuously budgeted for more recruitment, unprecedented. Why? Because we see that this is a need. So last year we did, this year we have done, next year we are hoping this can continue for the next 5 years, and by the 2026 we will see an improvement. Regarding operationalization, I want to ask members of parliament that we work together to ensure that we operationalize some of the facilities, the health posts, so we will work out a schedule and try to be equitable in all the provinces and see if we are going to operationalize 2 or 5 in Northern, we should do the same for the other 9 provinces so that we are not accused. The other point also is...
May the Honorable Minister wind up time? You're out of time.
Okay. I'm happy to stop your chair, Mr. Chairman.
Yes, yes, there are other things they can, because we have got a lot of business to consider.
Okay, so I'll conclude with the issue of completion of facilities. You recall, Mr. Chair, that we did have money allocated for completion, and we did indicate that the completion of structures, we are going to target those which were above 80%. So if your hospital is at 20%, I don't know what percent is Mufurira, you should understand, but you know very well that we are currently, I think they're about 9, 10 almost complete, and the year hasn't finished. So we are doing our best, so don't worry, we'll do what we can do. And all I can say is thank you to all the members for the support, and sorry for those that are still unhappy, but we are doing our level best. Thank you.
Head 46, Ministry of Health, head total 18 billion 732 million 259,790. Any debate? Any objection? The question is that head 46, Ministry of Health, head total 18 billion 732 million 259,790 stands part of the estimate. Mr. Banda.
Thank you very much, Chairperson. Minister, let me take you to page 476. That's in our yellow page. Table 4. Page 476. That's table 4. The program is 5532. Sub-program 02. That's on essential drugs and medical supplies. The budget for 2023, it was 1.7 billion. This year, you've dropped it to 1.1 billion, a difference of almost $500 million. Minister, why have we dropped it so much, knowing very well that these essential drugs are really required in Chimwemwe and other parts of the country?
The Honorable Minister of Health.
Thank you, Mr. Chairman. Mr. Chairman, in effect, there's no drop. Basically, what has happened is that there's some realignment of the budget because remember I talked about some functions of health going to the district. So some of the primary health services which were being performed at the national level now will be performed at the district level, and these resources will be going there. So what has happened is that resources for some of these services will be, have been realigned to be allocated under primary health services. Thank you.
Dr. Mwanza.
Sorry, Chairperson. I did not finish. I have 3, but because you asked to respond before I completed all my questions, I actually had to present all the 3.
I think if we allow...
Not because procedure, Chairperson, is for me to read all the 3. But before I completed, you actually asked the minister. I didn't want to interject.
You were quiet for some
No, I wasn't quiet because last time you told me I was so fast.
You may.
Thank you very much, Chairperson. Honorable Minister, this time I'll ask you 2 questions. The second one is on page 471. Are you there? Thank you. Table 3. The program is 5532. Sub-program 006. This is on infrastructure development for health services. Honorable Minister, on this one as well, in 2023, it was 1.4, and you've dropped it to 957. Already we've heard a lot of our colleagues complaining about their health facilities not being constructed or finished. And I know on the health services, CDF does not come in because we come in primary health care. The last one, Honorable Minister, if I may, is on page 469. Or can I, Chairperson? The Minister wants to answer one at a time. Can I sit and... or can I continue with the second one? Honorable Minister, sorry to overload you, but I'll go for the last one. Page 469. Are you there? Table 1. Number 26. This is on transfers. 2023, it was 1.5, and now it has jumped to 2.5. Honorable Minister, what are these transfers for? Are these transfers to the local authority, or is it also personnel? Because perhaps the 500 billion here could have been taken back to another sector where we need, especially like on essential health drugs. I thank you.
The Honorable Minister of Health.
Thank you, Mr. Chairman, and thank you, Honorable. The first one relates to infrastructure development, program 002, sub-program 002, and the funds are meant for construction of maternity annexes, rehabilitation and completion of infrastructure projects. The decrease is due to the alignment of 273 million medical equipment funds, which now is now part of the Primary Health Services Program 5531, Sub-Program 001. On the second one, on transfers, and just okay, these are transfers which will now go to the district level because Mr. Chairman, as I earlier indicated, part of the resources that were being held at the ministry due to decentralization will now be transferred to other, and then we also have some departments which have been realigned because initially we had some 17 or 16 departments, but now we have reduced to 9 and combined some. So you find that there's a bit of realignment of resources to specific departments, but in support of those that have since been merged. Thank you.
Dr. Mwanza.
Thank you. Honorable Minister, I take you to page 473. Primary, which is table 4, primary health services and sub-program 04, assets. Simple question is, you've budgeted for 57 million kwacha for prefabricated health posts. What is the rationale to provide the prefabricated health posts when we have increased enhanced CDF that we are constructing fixed stationary health posts or buildings? The next question. My question is on table 4, which is page 473, assets. You have budgeted for 57,593,327 under prefabricated health posts. What is the rationale to provide prefabricated health posts in this time and age when we have enhanced CDF to provide fixed stationary buildings as health posts? The second question is on page 474, table 5, infrastructure development. There's a massive reduction from 2023 budget from 574 million kwacha to 141 million kwacha in 2024. So what could be the explanation? Are we trying to justify that the Ministry of Health presence in our constituencies in terms of infrastructure development will not be there? I thank you.
The Honorable Minister of Health.
Thank you very much, Mr. Chairman, and thank you, Honorable, for your questions concerning the prefabricated health posts, which in the 2022 budget was at 34, and 2023 shows there's nothing, and I see 57,000. I want to believe that the issue of using fabricated materials has continued. As you know, in some of our provinces, we are, through donor support, putting up facilities, what you call warehouses for drugs, like small hubs in specific locations. And this is an issue that we have discovered, that a number of health facilities do not have sufficient space to store the drugs. And for the first time, we saw that when they started receiving drugs, they just found that the drugs were too much for them, for their places, and we are getting support from donors to build prefabricated hubs, small hubs in various districts of Zambia. And this is because these are quicker to construct and they are able to respond to the issue immediately. So that could be the answer to that point. And then the other one, thank you, sorry, Mr. Chair, I've just gotten some further clarification that in fact these ones relate to the health posts, the 650 health posts that have been under construction. And if you recall, there's still a small number. I think out of the 650, there could be less than 50 remaining. And I think these resources are meant to pay the contractors for the remaining health posts. So this is an ongoing contract wherein it was already agreed that they'll put up these prefabricated health posts. But of course, the MP is right that now, when we are constructing health posts using CDF, we are using brick and cement. But I also want to say that we can still use prefabricated materials, especially in very, very rural parts of Zambia where you are very far away. No, not Chongwe. You know, sometimes even the road network and, you know, and sometimes the issue is urgent. You can actually use that. It does help. And then in future, of course, you can use the brick if that's what you desire. Then the other question, Mr. Speaker, was on the next page. I think it had to do with the Institute of Infrastructure. Infrastructure, if I'm right, development. And the Honorable is asking us why the amount has reduced when we are talking about more construction of infrastructure. I want to say that, again, you will note that the budget on infrastructure may be reducing, not because we don't have need, but we have realigned the issue of infrastructure. If you recall in my statement, I did show that there is a very big amount of resource that have been allocated for infrastructure construction, which will include construction of the two cancer disease hospitals, the Ndola and Kitwe, Ndola and Livingstone, including completion of ongoing projects and also including some of of course, the hospitals which are not completed, but also constructing new where there's completely none, because there are some districts in all the provinces which were totally left out. So that again is something that we are going to do, except that some of these resources are now being shared between different governments, meaning between central government and local government at local authorities. Thank you.
Thank you. Dr. Chirofia.
Thank you so much, Honorable Minister. I'll lead you to page 473, program 227, Zambia National Public Health Institute. I noticed that the budget has remained static at 13,252,524 for 2022, 2023, and 2024. Now, public health emergencies, Honorable Minister, can derail government. Can derail government from its agenda.
I think maybe Honorable Dr. Chirofia tried to repeat the item, the Minister.
Thank you. Honorable Minister, page 473. Under economic classification, you go to 227, Zambia National Public Health Institute, stroke Africa CDC. And I have noted that the figure has remained constant from 2022 to 2024 at 13,252,524. Now, Honorable Minister, public health emergencies such as COVID, Ebola, and re-emerging threats of anthrax and other conditions can derail government from its futuristic focus on economic reconstruction
So it is therefore imperative that we invest in public health security. And the engine of this program is the Zambia National Public Health Institute. Honorable Minister, we know that we face an existential threat of climate change and also antimicrobial resistance. Wouldn't it be prudent that you consider increasing the budgetary allocation to health security in view of shielding our economic reconstruction program from the shocks of epidemics and the emerging threats of climate change and antimicrobial resistance? I submit, Chairperson.
The Honorable Minister of Health.
Thank you, Chairperson, and thank you, Honorable, for your follow-up question. I want to state that basically what you have said is correct, but this figure is not for everything that is required as you've articulated. Basically, there's some other resources that are going to ZMPHI from government, of course, through the World Bank, which is used for issues of surveillance and all that ZMPHI has to do, including construction of the new center for ZMPHI, which will be for the whole southern region. Now, if you look at this figure, this could just be for administrative and salaries, but not all the things you've said. But yes, we have that resource. Thank you.
I put the question. The question is at head 46, Ministry of Health, head total 18,732,259,790 stands part of the estimate. As many of that opinion say aye, of the contrary say no, the ayes have it. The question is resolved in the affirmative. Head 46, Ministry of Health, head total 18,732,259,790 is ordered to stand as part of the estimate. We now move to head 14, Ministry of Mines and Minerals Development. Head 14, Ministry of Mines and Minerals Development. General Policy Debate. The Honorable Minister of Mines and Minerals Development, Policy Statement.
Thank you very much, Mr. Chairman. I wish to thank you most sincerely for according me this opportunity to present the policy statement in support of the 2024 estimates of revenue and expenditure for the Ministry of Mines and Minerals Development under Head 14. Mr. Chairperson, as you are aware, mining has continued to be the mainstay of Zambia's economy, accounting for 17.5% GDP, over 70% of foreign exchange earnings, 30% government revenues, and contributes significantly to employment in the country. It is for this reason that government prioritizes the sector as key in fostering economic development in line with the 8th National Development Plan, which is anchored on socio-economic transformation for improved livelihoods. Mr. Chairperson, the mandate of the Ministry of Mines and Minerals Development is drawn from the Government Special Gazette Notice number 1123 of 24 September 2021, which is to facilitate and regulate the development and management of mineral and petroleum resources in Zambia. In presenting this policy statement, I wish to highlight the performance of the Ministry in the year 2023, as well as the focus for the year 2024. In 2023, the Ministry was allocated 275,000 kwacha, and of this amount, 82.7% has been released as at 31st October 2023. During the period under review, the Ministry implemented various interventions aimed at stimulating production and growth in the mining sector in line with the vision of His Excellency the President of the Republic of Zambia, Mr. Hakainde Hichilema, that of attaining 3 million metric tons of copper production annually by 2031. As such, government through my ministry is undertaking policy, legislative, and institutional reforms to accelerate the attainment of this target and others for the mining sector. So far, policy measures which include ramping up of geological mapping by 0.8% in 2023, covering some parts of the Copperbelt province and Wapla province from the current national coverage of 54.5%, and formalization of artisanal and small-scale mining subsector by formation of cooperatives in gold, manganese, and gemstones are ongoing. Mr. Chairperson, in terms of legislative reforms, the process of reviewing the Mines and Minerals Development Act has advanced to pave way for the establishment of the Minerals Regulation Commission to enhance the performance of the sector, while at the same time putting in place a legal framework aimed at increasing government and private sector investment in geological mapping and mineral exploration. In addition, the ministry is currently undertaking the process of formulating local content regulations to increase the participation of Zambians in the mineral value chain. To ensure that the country benefits from the global energy transition agenda, government through the ministry is formulating a critical minerals strategy which will result into the enactment of the legal framework to guide investment in critical minerals to maximize benefits for the people of Zambia. Chairperson, other interventions the ministry undertook during the period under review include adopting efficiency mechanisms in the mining cadastre system through investment in various ICT platforms to ensure timely issuance as well as enhanced transparency and accountability in mining licensing. The ministry also streamlined the administration and management of the Environmental Protection Fund by appointing a fund manager to increase its financial position from the current $40 million to enable the fund adequately address environmental liabilities after mine closure. Through the Zambia Mining and Environmental Remediation and Improvement Project, ZIMRIP, with the support from the World Bank, various interventions which include reduction of environmental health risks and lead exposure to critically polluted mining areas and improved environmental infrastructure in Kabwe, Kitwe, Chingola, and Mufulira were undertaken. Furthermore, to ensure mine safety, occupational health, and sound environmental management, the ministry undertook compliance monitoring inspections at various large and small-scale mining operations. In the 2024 budget, Mr. Chairperson, the ministry has been allocated 807 million kwacha compared to 275 million in 2023, representing an increase of more than 100%. The ministry will implement 6 key programs in 2024, which include mineral resource development and management, mine safety, health and environment, mines development and management, mines technical services, petroleum exploration and management support services. Under Mineral Resource Development and Management Program, the ministry will focus on undertaking various interventions aimed at attaining the target 3 million tons annual copper production through, among others, geological mapping and mineral resource exploration. To this effect, 198 million has been allocated to cater for geological mapping and mineral resource exploration in central, Lusaka, Copperbelt, southern, western, and northwestern provinces in order to attract targeted investments in various minerals such as nickel, cobalt, graphite, etc. To ensure occupational health, safety, and environment protection, the ministry under the Mine Safety, Health, and Environment Program will increase compliance monitoring inspections in both brownfield and greenfield mining projects. In addition, to ensure the effective and efficient licensing, the ministry will undertake measures aimed at ensuring compliance by holders of mining
and non-mining rights. Further, 25 million kwacha has been allocated under this program to facilitate the establishment of the Minerals Regulation Commission to strengthen the regulation of the mining sector. Under Mines Technical Services Program, the Ministry will provide technical support to ensure increased production for the mining sector, including artisanal and small-scale mining subsector. As such, 130 million has been allocated towards reorganizing the artisanal and small-scale subsector to increase its contribution to the country's economic growth by formalizing informal mining activities. To monitor exploration activities in the petroleum subsector, the Ministry will undertake compliance inspections under the Petroleum Exploration Program. Under Management Support Services, 17 million has been allocated towards digitization and automation of various services offered by the Ministry, such as licensing, geological services, petroleum exploration, and mine safety, health, and environment services. This is in order to ensure improved service delivery and increase government revenues. I wish to state, Mr. Chairperson, that my ministry's 2024 budget is reflective of the national priorities as outlined in the 8th National Development Plan and other national policy documents, such as the National Mineral Resources Development Policy. I therefore call upon this august House to support and approve the 2024 estimates of expenditure for my ministry, as the mining sector has enormous potential to contribute to wealth creation and poverty reduction. As the new donor administration, under the leadership of His Excellency the President of the Republic of Zambia, Mr. Hakainde Hichilema, I wish to take this opportunity to assure this august House and the people of Zambia at large that government remains committed to ensure that the mining sector plays a critical role in contributing to the socio-economic development of our country without leaving anyone behind. I thank you, Chairperson.
Any further debate? Mr. Mtachalo.
Thank you very much, Mr. Chairperson, to give the people of Chama North an opportunity to debate this particular head for 14. Mr. Chairperson, the mining sector continues to play a key role in Zambia's economic development, accounting for 70% of foreign exchange earnings. However, this sector is only contributing about 15% to gross domestic product. So I think there is need that this particular sector must contribute more to GDP and also job creation. Mr. Chairperson, I think as a country we have not really derived maximum economic benefits from our mineral wealth. So I think it is important that going forward we must be able to derive the maximum economic benefits. Many countries are changing now. Look, for example, Botswana. Botswana now is going towards renegotiating with the bears so that Botswana can accrue maximum economic benefits. So I think it is important that as Africa, as Zambia, we must be looking at not only exporting copper and other minerals in raw form, because we're exporting jobs and wealth to these other countries. So it is important that we must be able to ensure that we are able to process these minerals locally here. That way we are going to benefit more. That's why Kenneth Kaunda came up with a copper refinery. It was meant to ensure that we add value to our mineral resources. Mr. Chairperson, I think we are concerned, the people of the Copper Belt and Zambia as a whole are concerned about the situation at Mopani copper mines. A lot of statements have been issued by this government, but we are not seeing an investor taking over Mopani copper mines. That's why today, if you go to most of these towns which are run by Mopani is running these mines, Mufulira and other towns, they are almost ghost towns. Poverty levels have increased. because of unemployment. So I want to see to it that this government must quickly announce the investor to take over operations of Kokola copper mines. I believe that the decision which was taken by the previous government to take possession of Mopani copper mines, in my view, was made in national interest to ensure that Zambians can derive economic benefits from our mineral wealth. That time, Mopani just needed $300 million for the capitalization. But if you look at how much money is needed there today because of delaying to announce an investor, I feel that it is important that this government must quickly announce an investor for Mopani copper mines. I go to mineral exploration. I see that in the budget you have allocated 1.9 million from 1.2 in the 2023 national budget. I think this is a step in the right direction. However, I think we need to up our game, Minister, to ensure that we become radical in terms of mineral exploration. DRC is doing very fine in terms of mineral exploration. So I believe that much must be done in that area. Honorable Minister, I've also scrutinized the budget on mine safety and healthy environment. I've seen that there's been a substantial increase from 126 million kwacha in the 2023 national budget to 382 million in the 2024 budget. I hope that the ministry is going to put up radical measures to ensure that these mines do not pollute the environment and ensure that they comply to these safety environmental standards. I also noticed that if you look at the mines compliance with the environmental regulations, small scale target in 2023 was 250. But the actual was only 63. Large mining scale, 2023 was 16, actual 6. Compliance with the health and safety regulations, 2023 target 16, actual 7. 2024 target 16, actual 9. I think this is not a success story, Honorable Minister. I think more must be done to ensure that our workers who work in those mines their lives are safeguarded. So the Ministry of Mines Inspection must be proactive and ensure that we take radical measures to ensure that we have effective inspection of these mines. Mr. Chairperson, I want to talk lastly, mostly on the petroleum exploration. I think much has not been done in that particular area. I remember in 1986, Chama was hitting the headlines that oil was discovered in Chama. We had so many companies there operating in Chama. We had Josos, we had Africa Oil, we had the Placid Oil. They were on Chama, and we were told that we had oil deposit in that country. And the late President, Dr. Kenneth Kaunda, still believed that Chama has oil deposits. So I hope that this money, which has been allocated to the petroleum exploration, we want to revisit this particular exploration, Mr. Chairperson, so that Zambia can discover oil deposit. Many countries, Uganda and several others, I think they took a radical stance. They invested more to ensure that we do a lot in terms of petroleum exploration. Lastly but not least, I think I want to talk about the issue of Konkola copper mines. I believe that there's very scanty information. We are told you had signed the agreement with the investor. I think it is important that the people of Zambia needs to have more information about what is happening at KCM, because if you go to Chingola today, you find that there is no much life, there's no much activities happening at Konkola mine. So it is our prayer that this government is going to walk the talk and ensure that it actualizes whatever it pronounces. So with these few remarks, Mr. Chairperson, I want to state that the people of Chama North would like to support this budget estimates. Thank you, Mr. Chairperson.
Mr. Saluvalo.
Thank you so much, Honorable Chairperson. I'm trying to be... Honorable Chairperson, I do support this.
Now try to stand.
Honorable Chairperson, I do support
the budget for Ministry of Mines. I remember when we took over government, the minister in charge decided to close the cadastre office. A lot of speculations were made. Now, what came out of the closure, it was something that is worth smiling about. It is a system that has brought transparency in the way mining licenses are being issued. The most important thing that has come out of that honorable chair is the introduction of issuing mining licenses to cooperatives. This entails that the ministry is determined, seeing to it that the lowest organ of society, the people right there in Mansa, the remotest part of Mansa, where Sujrat is found, they will benefit. The remotest part of Sinazongwe, remotest part of Mapatizia, where lithium is found, it means locals will benefit. The remotest part of Mumbra, let me say Central Province in general, and also the remotest part of areas like Tambo, Serenge, and many more areas where there is gold and so many minerals. It means the new Dawn administration is saying the locals should benefit. Gone are the days, Honorable Minister, when Zambians were spectators in mining activities. You are doing a commendable job. All we need to do is to expedite so that the locals or in the remotest part of the country can start benefiting. Cooperatives should start working. Zambians have suffered at the expense of those with a lot of money coming from out of the country. We need our people to become millionaires. I'll be the greatest and happiest person, Honorable Minister, under your leadership as the Minister of Mines, saying that your ministry has created millionaires under these cooperatives that you are going to issue with licenses. Zambians, what makes Zambians sell the mining license that they obtain is capital to start mining. They fail to buy equipment. Now, in my view, what I feel should be of great importance that your ministry can do is to help our people. See how you can collaborate with the Ministry of Finance and also Commerce, trying to empower our local with ease loan facilities for them to buy equipment. We have a lot of equipment that has been brought by Chinese in the country where our people can lean on for them to make a significant financial gain in society. Honorable Minister, I know what is happening with Concola Copper Mines. You've done a commendable job. I know there are a lot of legal teething issues that will be addressed shortly. KCM will be back on track. In the same vein, Honorable Minister, please look at what is happening at Mopani. Come in as soon as possible so that you give a smile to the people on the copper belt by informing the nation whoever will be chosen as the new owner of Mopani Copper Mine.
Our people, they have sacrificed a lot. Under the new Dawn administration, our youth down out there, they want to benefit. Let these cooperatives start functioning, Honorable Minister, as soon as possible so that our communities, our youth can see what they voted for. We need, as we talk of value addition, Honorable Minister, each mine, there should be Zambians that should be part and parcel of ownership. By so doing, Honorable Minister, you will be empowering the current and the future generation. We own these minerals. God embedded these minerals in our own soils. We need to harvest. This is the right time that the Zambian people, the people in Mansa where Sujirat is, should start smiling. The people in Sinazongwe, the people in Mapatizia, and many more places, we need to give a face of happiness through these activities that you have undertaken. Otherwise, I'm grateful with the efforts that you are making as a ministry. I thank you so much. Thank you, Chair.
Mr. Mwira.
Mr. Chairperson, I thank you. Chairperson, as I contribute to this motion, let me start by referring to the mandate that this ministry has. The mandate of the ministry, Mr. Chairperson, is the development and management of minerals for the benefit of the people of Zambia. This is a very important mandate, Mr. Chairperson, because the people of Zambia must benefit from the minerals and the mineral wealth of this country. Now, having listened to the policy statement that the minister has presented, does it promote the benefits to the people of Zambia?
Order, Honorable Member. As the time is 19:10 hours, I interrupt proceedings and committee work stands adjourned. The Committee of Supply will report progress and ask leave to sit again. Madam Speaker, I have to report to the House that the Committee of Supply on the estimates of revenue and expenditure for the year 1st January 2024 to 31st December 2024 has gone through heads 53 and 46, has made progress and asked leave to sit again.
Day for resumption of committee work.
Tomorrow, Madam Speaker.
Committee work to resume tomorrow. The acting leader of government business adjournment. The chief whip adjournment.
Madam Speaker, I beg that the House do now adjourn.
As no notice of an item for debate on the motion of adjournment of the House has been received, I put the question. The question is that the House do now adjourn. Any debate? Any objection? The question is agreed to. The House is now adjourned.
As they are signifying the end of business for today, which has closed with Mufulira Member of our Parliament, Mr. Gordon Mwila, making contribution to Head 14, Minister of Mines and Minerals Development, which is currently under consideration. And so, with that effect, Pauline, we just give a summary of our business from where we started off earlier in the day.
Yes, we will look at what has been discussed on the floor of the House so far, and this is just a summary. There was one question for oral answer that was considered on the floor, and this is Understanding Order 76. The question came from Kasanengwa Member of Parliament, Mr. Philemon Twasa, and he wanted to find out from the Minister of Agriculture why government has delayed to deliver outstanding farming inputs for the 2021-2022 farming season, despite the assurances that were given earlier. And the second part of the question, he wanted to know what urgent measures are being taken to ensure that the farming inputs are delivered for utilization in the 2023-2024 farming season. And in response, the acting Minister of Agriculture indicated to the House that the 2021-2023 farming season, during the 2021-2023 farming season, one of the contracted companies, Nereus Investment Limited, failed to supply 17,541.55 metric tons of both D-compound and urea fertilizer in Central, Eastern, Muchinga and Northern provinces. And they said that this led to some of the farmers in the said provinces not to receive the fertilizer. And currently, the evaluation is underway, and award of contract to the suppliers is expected to be done upon completion of the procurement process. And the B part of the question, the acting minister informed the House that the Minister of Agriculture